Good morning. I'm Van Laskowski, and I'm the Vice President of Physician Practices at Stevens County Hospital. In the wake of the coronavirus outbreak, we will be posting updates daily at 9:30 a.m. We want to ensure that you are kept up to date on how the virus is affecting our region and what we as a hospital are doing to ensure the safety of our community. At this time, Stevens County Hospital has activated our Emergency Operations Plan, Code Triage Standby, in response to the spread of COVID-19. Today is March 17th, 2020, and as of this point, we have tested 3 individuals for the virus. We have no positive cases at this point. We have 2 results pending. We have 1 negative result. No patients have been hospitalized at this point. 4 patients are quarantined at home. 3 of those are still under quarantine pending results and monitoring. At this time, we are working with the Department of Public Health and LabCorp to be able to test patients for the virus, but there is a very limited supply of test kits available nationwide. As such, we are only able to test patients at high risk from the virus who are potential carriers based on CDC guidelines. Those at highest risk are older adults, especially those with certain comorbidities and chronic conditions like heart disease, diabetes, and lung disease. Others who are at risk are those who have come into contact with someone who has or is suspected of having the virus. Symptoms of COVID-19 are fever and signs of respiratory illness like cough, wheezing, or shortness of breath. If you think you may have the virus, please call your primary care provider. The best way to prevent yourself from getting the virus is by washing your hands often and by limiting your exposure to others and avoiding large gatherings. We have implemented several changes at Stevens County Hospital, our clinics, and personal care homes to help ensure the safety of our patients and staff. Effective immediately, all points of entry to the hospital are through the emergency department and our labor and delivery department. I want to repeat that. Effective immediately, all points of entry to the hospital are through the emergency department and our labor and delivery department. Beginning tomorrow, March 18th, we are also limiting visitors. All patients will be allowed 1 designated support person. This support person will receive a band similar to our hospital bands when the patient is registered. All individuals coming to the hospital or any of our other facilities should be prepared to have their temperature taken upon entry. This includes patients, visitors, staff, and any vendors. The hospital cafeteria is now closed to the general public and is open only to staff, patients, and their visitors. For more information about hospital operations, please call 706-282-4296. Again, that's 706-282-4296. We are limiting visiting hours to our personal care homes, Clary and Wilkinson centers as well. Visiting hours will be 9 a.m. to 5:30 p.m. If you need to come outside of those hours, please call 706-282-5600. Again, 706-282-5600. All of our clinics are open for their normal hours of operation, but we are asking that you limit the number of visitors who accompany you to your appointment. Anyone who is able, please come alone to your appointment. I want to reiterate that one of the most helpful things you can do during the outbreak is by calling ahead if you think you have the virus. This ensures we are prepared for your arrival and limit any risk to others. We truly appreciate your understanding of our enhanced protocols during this time and want you to know that we are doing everything possible to ensure our preparedness for this virus. We will be updating you every weekday at approximately 9:30 a.m. as information is changing very rapidly, and we want to ensure that you are kept up to date with accurate information. For more information, please visit the Department of Public Health website, dph.georgia.gov, or the Centers for Disease Control and Prevention website, cdc.gov. Thank you.